Hi, this is the Vanguard's monthly webinar. I'm your host, David Greenwald, Director of the Vanguard. We have a great panel to discuss a very important and pressing issue today, COVID, UC Davis, and kind of the future of higher education. And here with us, we have a really good diverse group of panelists. We have Ken Burtis, who just retired from the university. He's was a professor and also an advisor to the Chancellor. We have Jesse Drew, who's a faculty member and also the co-chair of the Faculty Association. We have Kyle Krueger, who is the current ASUCD president. And we have Julietta Bisharyan, who is the Vanguard's co-editor of our student publication that we just launched this fall. So thanks for joining us, everyone. So this is going to be probably a little bit unusual for our webinars, which we've been doing monthly since September. We don't have a huge audience today. Half the city is probably still without power. I was without power in the office up until this morning. I was very happy to arrive here early this morning and find that the lights were on. And so this was a go. And I know a good chunk of the city is still without internet. So that actually leads pretty well to, one of the downfalls of distance learning. I know I have two young kids in elementary school, and it's knocked them out of attending class, not being able to log on to the internet. I can only imagine what's happening at the university with at least half the students doing distance learning or being out of town. We're gonna have panel questions for the first part of this, and then we will go to audience questions. I see 6 people in the audience, so think up your best questions and put them into the chat. And Michelle, my assistant, will read them out during the second part of this. So I want to kind of get a sense for what it's like at the university right now, and just what is distance learning look like? Is this a good thing or a bad thing from your perspective? So anyone who wants to kind of jump in can start out. Think in terms of 2 to 3 minutes to respond. Kyle, did you want to go first?
Sure. Yeah, if we're talking about distance learning, yeah, it's been incredibly challenging. This has been, I think, as many could guess, a really hard year. I think both for students and instructors to disseminate material and to learn material. And so I think it's besides being difficult to focus and that sort of thing with an online environment, I think it's created really accessibility issues. And I would say, for instance, there's students who live in different time zones, international students, and there's, students who might just not have that same connectivity to internet. Like right now we're having issues with Davis, and some of these issues, like professors are being really accommodating for students who live in Davis, but there might be other internet outages in areas where students live in other areas, and so it's really challenging to make sure that students are receiving equitable access, I suppose, to the ability to take tests at a certain time, the ability to turn things in at a certain time because their internet could go out. They could be living in a different time zone where they can't take, they have to take a test at 2 a.m. And so I think that these challenges have been met with varying success by different professors. It's been kind of on an individual basis. And I know, the Academic Senate has kind of made a mandate to increase the amount of information available about courses before, before students sign up in Schedule Builder. But even then, there's no mandate to record lectures or anything like that. And so it's really on a professor by professor basis and how well some of these equity issues are being dealt with and accessibility issues are being dealt with. And it's very challenging for students. So really hard right now.
And Jesse, how is it for faculty members?
It's really a mixed bag. I mean, one of the things that I'd like to bring up is that one of the things that I teach is media archaeology, which is a history of media technology. And there's a long history of this kind of education I think is important to look at. It's not a new thing. Teledistance learning and these sorts of, sort of innovative learning strategies have been around and have been pushed by many universities long before the whole COVID thing. And so that the shock of this is that we were all pushed into it, whether we like it or not. So we're all sort of thrown in there kicking and screaming or whatever. So it's interesting to look at that history and tie it to what's going on now. I think in general, students and faculty have done pretty good job of trying to accommodate these things, but I don't think it's a long-term solution. Lots of things have been sort of tossed to the side in sort of a triage, and I think that, the first quarter, I think, was awkward and people were scrambling to figure out. I think the fall quarter was much more in place, but I think we're kind of running out of certain strategies. A lot of classes have been postponed, a lot of the hands-on classes, lab classes, et cetera, et cetera. So I think we've done an okay job in terms of the lecture classes, but I think we're kind of running out of options. And so I think that's what's going to be critical in the spring quarter and beyond, is how we can kind of recover from that. And I think there is going to be a struggle between administrators and faculty and students about the future of this type of teledistance learning. And that contradiction was there in the past also. The university has been pushing for these types of online delivery platforms. And so I think that's going to be a really interesting political development as time goes on, because the university, I think, and I say the university, not just UC Davis, but writ large, wants to maintain some of these because it gives them, it takes away some of the power from faculty and puts it in the hands of the administration more. And so I think that's going to be really interesting to watch play out in the months and years to come.
Ken, what's your perspective?
I concur with a lot of what Kyle and Jesse said. It wasn't so much a question of good or bad. In this case, it was necessary, right? We had to move to distance learning because of the circumstances. And so a lot of credit to the faculty for stepping up under just unbelievable circumstances, particularly at the very beginning when there was very little time to get ready. And credit to the students for managing to survive and in some cases thrive during this year, but it hasn't been easy. And I think pressures, are building on everyone. We're worried a lot about just sort of the stress levels on people. It's hard, right? As everyone is seeing in society. And I think, again, it's distance education or a different thing, online education, even in the same group, you can see ways in which it's good or it's bad. Thinking about what Kyle pointed out, so a lot of our students who come from underserved communities and have really, it's not just the power going out, it's that they where they live, they don't have good access. The university has tried to help in some cases, providing access to internet or encouraging those students, making it possible for them with financial aid to come back to the university so they even have the opportunity to do that. And so it can be a very negative thing if you don't have the right environment. But we also, before all this happened, we were doing some work with preparation for things like chemistry through distance online learning that were helping students who maybe had come from less well-resourced high schools, no access to AP courses, to help them catch up before they got to Davis, so they didn't get into freshman chemistry and run into a brick wall. And so their, online distance education was in service of those communities, right? And actually was providing a positive influence. So again, it's not so much inherently good or bad, it's how it's used, how it's delivered. And I don't, I retired just before I would have had the opportunity to experience this myself, but I don't think anyone thinks it's a great substitute for the in-person experience. And I think the administration would agree with that as well. We all recognize, and because of this abrupt experiment this year, maybe even drove that point home more, we all miss the in-person relationship that you develop with your students. There's no substitute for that. And so I think the goal for the future from my perspective is to focus on where distance education, online education can be a force for good, and look for those opportunities and use them, but not in lieu of what we all know is a great experience of in-person education.
And Julietta, what's been your experience as a student attempting to shift all of a sudden to online learning?
For me, it's been a mixed experience. It's definitely been challenging in the sense that, you don't get to engage with your classmates and professors that much. Part of the reason why I'm living in Davis and not in South City is because my connection back at home was like not very good. So the reason why I'm living in Davis is because our internet's just better here. So that's a challenge that a lot of students face. But also I feel like there are some positive sides to distance learning. I think some students are more comfortable with participating in class and, using the chat function. So there are some upsides to it. I think it really depends, like professor to professor and like even major to major. I can't speak for my STEM roommates who are like not having their in-person labs anymore, so they're not getting that hands-on experience. But as an English major, I feel like I've been able to do pretty well. You just have like your ordinary Zoom discussion classes, so it really depends from class to class, I feel like.
And it really depends field to field. And I've had an interesting experience of overlapping all sorts of different fields over the last year. So as a parent of elementary school kids, it's been a disaster. There's almost no mitigating that. But what do you do? I mean, you don't want the kids to get sick, you don't want to get sick, and you don't want the teachers to get sick. As somebody who has a business that's largely online, it's been a huge benefit. We've been able to do things we never dreamed of doing because all of a sudden we realized we could organize and reach out to students all across the state. And so instead of just having a few interns at UC Davis, we have probably 50 to 70 interns right now, and they're all over the state. And we're able to have them log in and monitor court hearings that are online rather than having to go in. And we're able to do training online. And so there's a whole bunch of things that we can personally do that we couldn't do before. And we'd probably like to keep a lot of that. I know a lot of businesses, especially tech businesses, are now, downsizing their office space because they realize that their workers can be just as productive from remote, and they don't have to commute, and they don't have to maybe spend the huge, rent and housing costs of the Bay Area to do that. So that's been a big benefit. But I also think, the university has kind of had a mixed experience. I think UC Davis has done better than most in terms of keeping COVID infection down. But, the learning definitely is going to suffer, especially for people in the STEM fields, as Julietta pointed out. So how do we look to the future and maybe try to get the best of all worlds here. Any ideas on that?
You know, I'll say something, but I'm really just throwing it towards Jesse. So I think this forced experiment has sort of laid it out in all its gory detail, the good and the bad and the ugly. And I think the challenge now is to perhaps assume that we're heading back towards something like what it was before, but with more awareness now of what's possible. And so the question is there anything, you know, good that can be pulled out of that, that serves the students in positive ways and not just the negative things you can think of. So I sort of toss that to the person who's still in the ring.
Yeah, I would agree with that. I think that, you know, because we were forced into this by these circumstances, it hasn't really been, you know, faculty initiative to enter into this situation, sort of circumstances, and the administration, all right, because it was kind of an emergency thing. I think it's time for faculty to take an independent look and figure out what are the pedagogical advantages to this, and try to weed those out, separate them from you know, some of the advantages that that might be, you know, monetary, or it might be administrative, top heavy, et cetera, et cetera. Right? So I wear another hat here. I'm on the board of the American Association of University Professors, and I'm actually putting a panel together that's going to be next month on this very issue. Like, it's time for faculty to kind of come together and figure out what we do with this model in terms of, you know, what's a pedagogical correct way to proceed with this. And there are advantages and there are disadvantages, certainly. So yeah, I think it's all, you know, we have to figure this out, certainly with, you know, I think the perspective of the students is going to be critical here too, because I really do see that, you know, the primary focus of the university should be the faculty and the students, not the administration and the staff.
I totally agree with that. I think we all are in service to the students, right? The faculty are in service to the students, the administration's in service to the faculty and the students. And so, and it hasn't been, of course, just Davis. I'm glad to hear that you're involved with nationwide, because this experiment's been done all over the country, and no doubt there are things to learn and things to learn about. Yeah. It's not clear this will ever happen again either. So, you know, good to take the lessons we can and be ready.
Right, and I should say, as the AAUP represents, you know, not just, you know, UCs, but the state colleges, the private colleges, the community colleges. And, you know, I have to say that UC Davis is handling this a lot better than some of those other sectors are. I mean, it's really dire in some of the other sectors, like private colleges and stuff, which are sort of, you know, eliminating faculty and, you know, pushing everything into a teledistance model that's top down. And thankfully, UC Davis is not to that extreme. So that's, you know, kudos to us.
So Kyle or Julietta, any thoughts?
Sure. Yeah, I think to some extent, like I think students want to be back in person once it's safe to be back in person, and doing classes pretty close to the way that we used to do them. And so I think, you know, for accessibility reasons that I've mentioned, and just, I mean, even just you know, when you're taking a class over Zoom, you know, it's harder to have those conversations with the professor after class where you just go ask a quick question, or you make a connection. I think that goes for a lot of activities. And so I think that there definitely is a desire from students to be back doing classes in a way that's pretty similar to the past. But with that being said, I think that there are some things that we've learned from distance learning about what is possible, and that might result in some changes for I hope, the benefit. And maybe one of those is, I think that there's more faculty recording lectures than there used to be before distance learning started. And so, and I think that there was kind of a fear, and still is to some extent, a fear of recording lectures, because, you know, there's a fear like, oh, it'll get pirated or something like that. but I think that it's really beneficial for students, for me to, to be able to, scroll back and kind of hear the same thing a couple of times to really make sure I understand what's being said, for instance. And so maybe that's one beneficial thing where more faculty would be comfortable recording lectures, as an example. But I definitely hope that, once it's safe, that we're back in person in a manner that's not far from where we were in the past, and maybe have taken a couple of lessons from distance learning in ways that are beneficial.
Julietta?
Yeah, I agree. I think what this pandemic has taught us is how much we can do remotely, just from lectures and, having even discussion, like breakout rooms and all that. Like, we've been able to adapt so well. So I do think that some type of distance learning will always exist in the future of education. I just know, yeah, like Kyle was saying, like recorded lectures, that's definitely a huge benefit for so many students who, need to go back and watch their lectures again because they didn't catch it the first time. I know some professors before the pandemic would record their lectures while they were giving it live. So I feel like that sort of approach may be implemented more in the future. But yeah, I definitely do see like a majority of students do want to go back in in-person classes, but also I do know a couple of students who are like really thriving right now. They love like the whole distance learning thing because they're able to work with their schedule and they can just listen to class while they're at home just doing something else. But then again, like that, when you're at class there are less distractions like in person. So I don't know, it's a double-edged sword, but there's benefits to both, and I think some aspect of distance learning will always be in the future.
So I'm wondering, and this is probably a question for Ken or Jesse, what's the plan in terms of UC Davis? Are they planning to do this model until the end of the year? Are they going to reevaluate it at some point? What's the plan at this point?
So I'll start and then throw it over to Jesse. I did consult with the provost yesterday to find out if there was anything that I wasn't aware of that had happened recently. So my understanding is that spring is going to open up just a little bit more than winter. So the two areas: one, a continued opportunity under the blessings of the Senate and the administration for faculty to come forward with proposals, which previously have mostly focused on laboratory studio type experiences where it really has to be in person. But with the idea that we have a lot of seniors now who are going to have missed a whole year. And so the idea of opening up some senior capstone courses that may not be a laboratory, that technically could be done under Zoom, but aren't the same thing, and figure out safe ways to do those. We've had some experience now for the last 2 quarters in how to safely bring people together under appropriate conditions. And so I think that spring will be a little bit more open and kind of a trial run. Summer is still sort of to be determined. We had record enrollment in summer school last year from people that maybe are otherwise stuck somewhere and have nothing else to do. So it's a great time to pick up some units. And then we're really hoping that between vaccination and everything else that's going on around testing and everything else, that fall can begin to return back to what we were doing before. We're still obviously going to have this with us for a while, but hopefully we'll work our way through the vaccines and people will continue to model the good behaviors that Davis is doing very well, frankly, for the most part. And so very optimistic for the fall. So Jesse, did I miss anything?
No, I think that's, pretty much it. I mean, I think there is, and some of the things that I've seen though is sort of an assumption that a lot of these classes will remain online. Nothing that's written down, but there has been in meetings that have come to our attention of our faculty, there is kind of these assumptions that like, well, we need to figure out what's going to remain distance learning and what is going to go back to normal. So I'm a little concerned about that. And it's much stronger at other campuses also, because I think it's important that we don't allow the kind of the shock of going online to sort of numb us to the fact that we really have to be careful about what should remain online and what should not be. And one of the things I want to point out is if I can evoke the spirit of either Marshall McLuhan or Paulo Freire, is that this type of education is very thin. It's very two-way, or even, well, it's really one way. And I think that ultimately is a weak way of education. One of the biggest lacks that I see is the lack of communication among students. It's one thing for the faculty to project out and maybe feedback from the students, but as a faculty person, I always say, hey, you know what, you're going to learn as much from other people in this class as you are from me, and ultimately those connections you establish with the other students are long term going to be more important than the relationship you have with me. So I'm worried about those connections not happening, and so that's one of the reasons why I'm very interested in getting back into the classroom.
Yeah, go ahead.
So I just wanted to build on that. One of the last things that I was doing before I retired was working on providing spaces on campus for faculty to do, particularly in things like the large classes in the STEM disciplines, more active learning, right? So the kind of things you see in a small classroom had a lot to do with getting California Hall built. That was designed for that kind of experience. So I kind of feel like we were on the verge of a great experiment, a lot of faculty interest in moving forward, and it all got interrupted by this. And as Jesse said, then we ended up with this, at worst one and at best two-way interaction for teaching. So I kind of feel like everyone's anxious for that to be over and go back and pick up the experiment, which was really aimed at outcomes, right? What do students get out of their time with the faculty? How can you get the greatest value out of the time that you spend together? And so I sort of, I hear what people are saying, but I almost anticipate a backlash. It's like there's a hunger to go back to that, right? After all this enforced distancing, it's just like the hunger of all of us to go out and be with people and to talk to people and to do what we were doing before. So, there might be a backlash. So I do think, I see something in the chat section about whether there'll be pressure. We remember a few years ago when Jerry Brown was pushing for more online education for reasons of efficiency and access and cost cutting. I think there's a hunger to return to what it was, and I really think there's an opportunity, and I really think it falls on the faculty, as Jesse said, to look for the good. Is there some place where we get something good out of this? But let's don't do it for the wrong reasons, and let's not do it just to cut corners or for budgetary reasons. If anything is done in pedagogy, it should be done for the right reasons, which is in service of the students and what they learn.
And let me pick up on one of the questions from the audience, and then I have a question for Kyle after this. Any evidence, you'd mentioned that there was going to be some limited opening in the spring, but is there any evidence of in-classroom COVID spread from those offerings the past 2 quarters?
So no, and I'll even expand that. So our a university we're often held in parallel to, Cornell, maintained a much more robust in-class experience than we did. They initiated a similar massive testing program that we've done, but paired that with a return to the classrooms. And even with the large numbers of students that they've had back in classrooms under appropriate conditions, with distancing, with ventilation and so forth, the last time that I talked to one of their vice chancellors, they had no examples of any spread of COVID that was attributable to their open classrooms. There were still students who would be picked up as positive, but when you did the appropriate tracing, you always discovered there was some other avenue for infection. So I think under the right circumstances, the right mask, the right ventilation, the right spacing, it is possible to do classroom instruction without inordinate risk.
And along those lines, Kyle, my question was, why has UC Davis been so much more successful? I mean, I was just reading an article. I went to Cal Poly San Luis Obispo, where I grew up, for undergrad, and they've had all sorts of problems. UC Davis has avoided it. Do you have a sense for that?
That's a really good question. You know, UC Davis really has been more successful, and I know during the summer, you know, I think I and a lot of student leaders, like, just naturally, you know, despite seeing a lot of the coordination going on behind the scenes, and you know how much was being planned, and how well it was being planned, I think that there was definitely a lot of anxiety going into the fall for students, like, oh my gosh, there's going to be, you know, an outbreak in the first few weeks, and there wasn't. UC Davis was pretty successful. And I think in part that might be, like, I think a lot of the universities that get a lot of the publicity for being unsuccessful, they had a lot more classes maybe offered than UC Davis did, and they didn't really, you know, spend the amount of time that Davis did on, you know, safety precautions and test and trace and that sort of thing. I think that we just had our testing was in place. It was really clear how to get tested. You know, we had a limited number of things open on campus, mostly basic needs resources and, like, you know, access to the library, and then just a very limited number of classes. And I think that kind of the moderation combined with, well, I think the precision to making sure that, you know, people are getting tested, I think that that ended up working out well. And it might be too, I think Davis has had more communication with the city than some other schools. And so, like, Healthy Davis Together being an example of that. And so I think that the back and forth between Davis and the city might also be part of it, because you can't really you can't really guarantee that things are going to be fine on campus without, you know, making sure that when students are off campus, that there's the proper services being provided as well. And so you know, hopefully that partnership continues as well as it has been going. You know.
And Julietta, you know, what are you hearing from the other students in terms of this culture? It seems like taking it maybe a little bit more serious than some of the other campuses that we've heard horror stories. What was it? Was it Notre Dame where the whole quad, there was a big party at one of the universities, maybe it was North Carolina, they all bore together, but we haven't seen a ridiculous behavior like that at UC Davis. What are you kind of hearing from your peers?
I don't know. I've kind of been hearing that. Yeah, I would agree. UC Davis is doing pretty good with handling the pandemic. They've put a lot of, you know, safety protocols, you know, for entering campus. You know, just, you know, for going to the library, you have to do the campus survey and do all these, like, you know, make sure you had like your flu shot, your flu vaccine, and all that. So yeah, I definitely do see that UC Davis is taking more precautions. And I also think it might be partly due to the fact that Davis is a college town. Like, you know, a good majority of the people living in Davis are students. And so, I don't know, for that reason, I feel like there aren't that many, I guess, gatherings with like large groups, because, you know, people are either, you know, living back at home where they're originally from, or they're just living in Davis. So I don't know, I haven't really heard any negative, you know, I haven't heard about a lot of outbreaks going on in Davis. But I do think a lot of students do want to go back to in-person classes as soon as possible. But I do think a lot of them want to make sure it's like absolutely safe beforehand. Like, I don't think anyone's in a particular rush to go back, because they want to be safe, of course.
And Jesse, do you have any concerns about, you know, kind of the next 6 months? We're kind of in a weird time. We have the vaccine, we have kind of plateau, at least at this point, in terms of COVID spread, and then we have the threat of maybe new variants that could be more threatening. What are your concerns over the next 6 months or so?
So was that directed to me, because I dropped for a second?
Yeah.
So yeah, I don't think I have anything in any extra wisdom to share that anyone else wouldn't have. I wish I did, you know. I think that we pretty much just have to keep doing what we're doing. And I think we're doing a pretty good job of it. I mean, going down to the ARC and getting the testing every week is just, you know, really an eye opener. I don't really see any change from that until we can get the vaccines rolled out, and we make sure that the new strains are handled by the vaccine. Obviously, you know, the state and the hospitals have to get it more together in terms of, you know, how they're getting these vaccines out and to who. I think that's still kind of chaotic. But I don't really see any change other than continuing to do what we're doing. And like Julietta said, to make sure that it's safe when we all go back. And that not only goes for the university, but it goes for all the, you know, the high schools and the primary schools in Davis.
Ken, your thoughts on that?
Yeah, a couple different things. So one, I think Kyle and Julietta are too modest. One of the reasons that that the campus has managed to keep things under control is because the students have risen to the occasion in terms of their behavior. That is probably the biggest difference between what you saw in Notre Dame, and I think, you know, people have seen these horrifying pictures over the years of spring breaks and parties and so forth. And the Davis students, as Davis students always do, sort of rose to the occasion and really took it seriously. And I think that's been one of the reasons. So as you know, I was recalled to my position at the university, but mostly to serve as the chief operating officer for Healthy Davis Together. So I've been pretty intimately involved with the details here. When this first started, you know, we were the concern that we were starting with was a concern the town had expressed that all these COVID infected students would return to campus and infect the good town of Davis. And what we have seen over the last months has been that the rate of infection on campus has been much lower than the rate in town. So if anything, the fear was the opposite, that the good students of Davis would get infected by going into town. But both are fairly low, and I think Healthy Davis Together and people's behavior has been one of the things that kept them low. You talked about change coming forward, and I think Jesse and you mentioned the obvious. We were all worried about the variants, and we are setting up to begin screening for the variants locally through Healthy Davis Together, through the Genome Center, to get a little bit of forewarning, but we know that things will get here sooner or later. We're worried about people who are hesitant to get vaccinated, and we really hope that we get a plentiful supply of vaccine and that people will participate when their turn comes. But the other change, and it's just foreshadowing a question that Alan Miller put into the chat, is the campus testing operation at the Genome Center started just as an internal campus thing. So what can we do to start getting our own people tested during the spring as in the summer as we have students here? And it was focused very locally. And of course, COVID doesn't work that way. It spreads, right? And so one of the things that became apparent early on was that because the university is so intimately intertwined with the community at Davis, that it made no sense to get it under control on campus if it was running rampant in town, or vice versa. And so we began expanding the horizons of the process to reach out to the town so that we could get it under control in a way that would be sustainable. And so that's an ongoing process. We still don't have as many people. We can mandate that the students be tested, but we can't do that with the good citizens of Davis. So we're blitzing the town with advertising and inducements and so forth, and trying to make it as painless and easy as possible to get tested. We'd still like to see more of the people in town take advantage of that opportunity. And I think we just dropped 31,000 pieces of direct mail. They're going to show up in everybody's mailbox if they haven't already, inviting them down. But it's as Alan points out in his chat, there are higher rates of COVID infection in the rest of Yolo County. And in fact, I would even go beyond that, outside of Yolo County, to the state, to the country, to the world. COVID is a disease that you'll never get under control if you don't bring it under control everywhere. You can drive it down, but it'll come back again. So we're doing what we can. We are exploring ways to continue to expand beyond our initial goals. Of course, our prime objective was the safe opening of the university, and that's where we've been focused. But as we are able to obtain the resources and the capacity, frankly, it's remarkable how much testing we're done. We've done 110,000 tests or so in the last, since the Genome Center started. We would like to continue to build that. We are hopeful of continuing to reach out further afield from the campus, but it's just, you know, constrained by our ability to do that. And of course, our primary objective is the experiment that we're doing here to see, can a university town successfully operate under these conditions that we're under through enough appropriate behavior and testing. You cannot test your way out of an epidemic, but it certainly helps. You know, we've identified over 800 people since November with COVID infections in town. And just in the last week, I think we found 92 in town and 28 on campus. That's out of 15,000 tests on campus and about 7,000 tests in town. So it's still out there. You know, you cannot let up your guard. You have to keep at it. And one of the things I worry about for the next few months is that as vaccine begins to go out there, that people will somehow think, oh, okay, it's party time, relax, let's go back to business as normal. And we've seen over the summer and then around Christmas, these oscillations, you know, just when it's getting good and it's starting to head in the right direction, you know, it'll happen and it shoots back up again. So that's what we don't want until we're all vaccinated. And then we still are worried, you know, we've all seen the news this morning that the Brazilian variant has arrived in South Carolina, which means it will spread. And it seems to be a little less suppressed by some of the vaccines that are out there. So this is going to go on.
Yes, this is really extraordinary, unfortunately, you know, and disappointing, I think, nationally that we haven't done better, although I'm not surprised that Davis has done pretty well. Everybody, you know, that I know has really taken it seriously in this town, but you don't have to go very far to find people that are not masked around town or elsewhere. So Kyle and Julietta, kind of your thoughts and concerns about the next 6 months, if you have any.
Yeah, absolutely. I would agree. First off in saying, like, I think students, like, I think that we are a big part of why it's going pretty well. I think that the culture at Davis has been to take this seriously and to stay within your social circle, and so it will be interesting to see as just as vaccines are rolling out, you know, how that changes the number of cases, and you know, if people I suppose relax a little too much. I think one of my main concerns as we head back into the fall, kind of for academics, is, you know, there's definitely an expectation that there will be things that are back in person. There will be in-person classes, and that's great. I think if it's safe, that is what students want once that's available. But with that being said, like, there's going to be students who can't get tested for, you know, whatever reason. There's going to be students who live out of the state, and, you know, might be getting tested at different times based on, you know, what their state is doing. And so I think that sort of disparity could end up creating some inequities heading into the fall, and in who can access the campus and who can't. And I think that's going to be a challenge that, you know, faculty, administration, and students will have to figure out, you know, how is equal access provided to both students who are coming back on campus, which is something that I think that we want, but also to students who can't come back on campus yet. And so that's a challenge that's going to have to be addressed. Yeah.
All right, Julietta.
Yeah, I guess my biggest fear for the next 6 months would just be if the pandemic gets any worse, specifically in Davis. I would agree that students are a big reason why, you know, the numbers of cases have been low. I don't know about any the people I know in Davis are like very responsible with the pandemic and, you know, taking safety precautions. But I do also think that, you know, when the news of the vaccine did first arrive, people did relax a little bit with, you know, just COVID precautions because they thought, oh, the vaccine would just fix everything. So that is one concern, that people will just stop taking it seriously because of the vaccines. And yeah, like with fall quarter, I think there will be an issue of who has access to the vaccine, especially if they're coming out of state. And also, you know, if vaccines do become a mandated thing in order to access campus and in order to attend school, then that might also be a challenge, and that might also conflict with like the teachings. Like, cause then if professors want to go back to just in-person classes, then some students might, you know, not get the vaccine or whatnot, and then they wouldn't be able to go to class anymore. So I don't know if that makes sense, but yeah, I do think there are some challenges within the next 6 months, but I think if everyone takes the right precautions, and it should be fine. But yeah.
Ken, I'm wondering if you know, is the schedule for the vaccine such that students should be able to be vaccinated by the end of September? Is that correct?
That's a $64 billion question. Nobody knows for sure, right? So the hope, of course, and you've heard the President of the United States express it, is that everyone will be vaccinated by the end of the summer. You know, I think we got some somewhat good news this morning about the Johnson & Johnson vaccine, single shot vaccine. It's not quite as effective as the first two vaccines for preventing mild cases, but it does seem to be equally effective for preventing people from getting hospitalized and serious infections. And so that the Johnson & Johnson has said they'll be able to pump out 1 billion doses of the vaccine over the next year. So I think there should be enough if we can get organized. You know, it's been a bit of a crazy quilt of different agencies. You know, the vaccine's been coming to the state, to the counties, to the healthcare providers, to you know, the drugstores. It's been such a confusing rollout that it's hard for people to tell. I know from my own healthcare provider, I happen to have UC Davis, the healthcare provider, that you know, they're getting some vaccine. They're following the state's guidelines and passing it out in order by age. But so yes, I think people will probably be vaccinated if they want to be over the summer. I do worry that some people are reticent to take the vaccine, and you know, the university does have other rules about vaccination for other diseases. So we have experience in dealing with those sorts of things. I actually had wanted to throw a question to Jesse, sort of paralleling what Kyle said about the students, which is, this is such a strange disease that affects different people so differently in terms of their risk factors. I can imagine that for some people by fall, if most people are vaccinated and COVID is infrequent, that some faculty who perceive themselves in low risk categories, well, yeah, I'm going back in the classroom, and others could be quite concerned and sort of express I don't want to come out until it is absolutely safe. And so how to deal with, you know, what's fair for the students, but what's fair for the faculty. And I wonder if Jesse and his colleagues have been discussing that issue.
Yeah, I think that is an important issue. And I think that the population of faculty is, you know, not that different from the population at large, which also has those same concerns. And hopefully we'll be able to sort of take a sort of like individual by individual kind of case, because, you know, there are faculty that I know who are in a more precarious, you know, health situation than others. It might have to be on a somewhat voluntary basis at some particular point. Of course, you see the same thing in the high schools and elementary schools right now also. I mean, I know faculty who are raring to get back to campus now, you know, and you know, at a certain point, we're going to have to figure that out. But you do see that wide spectrum, and I think that's, you know, what we're going to have to negotiate in the months to come. You know, taking into consideration you know, individual health needs of both faculty and students.
Yeah.
We do have a bunch of audience questions. Michelle, do you want to start with the ones that haven't been asked?
Sure. So the first question is, the state has funded public higher education at lower and lower levels over time. A few years ago, the state clearly thought MOOCs, or massive open online courses, and other new technology would allow them to cut funding even more. Will the state put a lot of pressure on UC to save money by providing a lower quality education using a lot of pre-recorded lectures? Governor Newsom's January budget proposal calls on UC to make sure at least 10% of future classes are online. Is this fair to current and future students? What can we do to preserve the quality of higher education?
I think it's a good one for the students to answer.
Yeah, I can
For
start.
me,
Go ahead.
sorry, go
Julietta.
ahead.
You go. Yeah,
Okay.
you're good.
Okay, for me, I definitely would say that distance learning and has really made me reevaluate the cost of education, and just how much I'm paying for what I'm getting. Yeah, like it's just made me, and it's made me reevaluate like what education really is. Like at the end of the day, for me, like, I'm just listening to a 40-minute recorded lecture, and I'm, and I don't even get to communicate with my professor or my classmates, and that's what I'm paying for. And of course that's that's all that can be done. It's fair, for the time being, and that's how we had to adapt to it. But it definitely has made me kind of question, like, oh, this is what I'm paying all this money for, which, like, again, it's what can you do? But yeah, that's my 2 cents on that.
Yeah, and I would echo what Julietta said. I think that definitely concerns me that there is a push to try to move things online permanently, because I mean, there's already, I mean, students are already upset that they're paying the tuition that they're paying with things being online. And I think for students to continue paying so much for college, and for students to continue to pay so much for college, and for things to be moving to an online format where the quality of education is no longer as good, I think is problematic. And so I think that there's definitely a desire from students to not have things online once it's safe. And hopefully, again, we take some of the lessons that we've learned from what is possible with recorded lectures, and maybe accommodations for students who can't make it to campus one day. And we take those, but we take them back to an in-person format, not a format where 10 to 20% of things are online. So, yeah.
Okay, so the next question is from Alan Miller, and it's directed to Ken, but I think other panelists can answer it as well. I have been on a campaign to expand the testing resources of Healthy Davis Together from city residents / workers to Yolo County wide. Not sure, or sorry, just a few targets, but the whole county, since the county has a much higher infection rates than Davis. I have contacted the council and county board, Vanguard, Enterprise, but who at UC Davis do I contact regarding Healthy Davis Together policy direction?
Right, I think I sort of addressed that one in part already. I sort of jumped the gun a little bit, and I'll say right now, I'm probably a good person to contact to talk about that, and I'd be happy to talk to Ellen or anyone about that. Again, the program is sort of growing from its initial purpose. Its initial purpose was to open the campus safely, and then realizing that was important to also open to gain control over the infection rates in town in order to do that. And that continues to be the primary mission. That said, we certainly are not unaware of the needs. I live in Woodland, certainly aware of the needs in Woodland, West Sac, Winters, and not just stopping at the boundaries of Yolo County, but on into Sacramento and on down the state. We look in horror at these long lines for testing in other communities. And so it's just a question of continuing to try and find the capacity and the resources to continue to do that. We have, as Alan pointed out, made some small inroads in that area by reaching out to specific groups, the long-term care facilities all over the county where people are at particular risk, other groups, the first responders in the county, who, inherently in their job are facing risk, but we recognize there are a lot more people than that. And frankly, we're happy to share the technology that we've developed with others if they come forward with solutions for the infrastructure. But it is not a small thing to set up these massive testing operations. And so at this point, we're sort of focused on our goal, but with an eye towards expanding out. We've shared our technology with others around the country as well. We think this was a particularly good way of doing testing that we developed here in our Genome Center and at Davis. Others have used different approaches elsewhere. And again, it's not all about testing. If everyone would follow the well-known guidelines for distancing and mask wearing, some people are always going to be at greater risk because of the nature of their jobs, but we could knock it down quite a lot based on that. Testing is actually, it's not something that so much benefits the person being tested. It benefits the people that they come into contact with, right? So you're just trying to prevent people. This is this bizarre disease that can be spread unknowingly. And so, if you get tested and you're positive, doesn't make your treatment any better, doesn't change your treatment, doesn't do anything for you, but it does make it so that you, if you're not staying away from other people and wearing a mask and so forth, won't unintentionally infect someone else. That's really what testing is all about. But we do hope to be able to continue to expand, and we are working on that, trying to find ways to do it. So
We're good.
Okay. Next question is, does the university have a faculty vaccine plan for students, for staff, or is the vaccination plan primarily orchestrated by county/state actors with little control afforded to UC Davis?
So the control is at this point sort of the vaccine supply and the ability to help deliver it, with the accent on the former. So the supply of vaccine is coming through different sources. So to the extent that UC receives its own supply of vaccine, it'll follow the state guidelines and whatever the priority list is and work its way through the people that it's responsible to. Healthy Davis Together is willing to help provide staffing for vaccine delivery if we can find a source of vaccine from somewhere. Or this may be one of those areas where HDT reaches out to the whole county. It's not going to get involved in a vaccine effort just for the citizens of Davis, but it would be trying to help the county reach out and provide vaccinations to communities in need that may not be able to get their vaccine through their own healthcare provider, people that don't have a personal healthcare provider. So it's a complicated mass group effort, and the university is ready, has already set up the appropriate staffing and facilities if there's a vaccine supply to be able to do that under the state guidelines.
Yeah, I would add that this sort of points to the absolute failure of our healthcare system, that the crazy patchwork of providers is just insane for an industrially advanced country like ours. The fact that we don't have a system like Medicare for all or a national health system to do this is just nuts. And I hope that people realize that moving forward, that we can do a lot better than this. Otherwise, it's everyone scrambling for themselves now.
Yeah, Jesse, I don't think you probably meant to aim that at the healthcare providers who have been doing a heroic job of the national system of healthcare, right?
I'm talking about our government.
Right.
Yeah.
All right, Michelle.
Okay, so the next question is, are there concerns and/or plans regarding balancing the upcoming spring season in terms of sunshine and warmth COVID fatigue, and mental, physical, and social urges to get out, with how to encourage students to continue acting safely and within the rules.
Kyle, you get that one first.
Sure. Yeah, I would start. I think that's a great question. I think it's great because it touches on how hard the situation has been for students. This has been, I mean, for mental health, just really challenging especially for students who already, have issues with mental health. I think it's really exacerbated that, and so I think that there's definitely desire, especially as we go into the spring, like you said, with the sunshine, for more social interaction, to be able to go out and meet people and to do things, and I think it's going to be really challenging to say, like, we still can't really do that until people are vaccinated. We have to stay within our social circles, and so I know from the perspective of ASUCD, it's doing what it can. We're doing what we can to have virtual events, and we have a virtual picnic day, and we're going to have a virtual whole earth festival, but it's definitely true that those events they're not the same thing as they would have been in person, and so we have to hope that those things are enough, and that in that our current little social circles that are safe during COVID are enough, and then and just know that we'll be able to expand those again, once sometime in the future when people are vaccinated and when it's safe to do so. But yeah, I think it is a really challenging time for mental health, and I think a lot of it too is just going to be making sure that we're providing the counseling resources and the mental health resources to help students through the challenge of kind of the social isolation that the pandemic has created. And so I know that there is a campus task force that's focused right now on figuring out how do we expand mental health resources, especially given the issues that have happened during the pandemic. And so I hope that that we are expanding mental health resources in ways that speaks to the diversity of student needs, I think, with mental health, and make sure that mental health resources are being kind of tailored toward specific student needs and from students of different backgrounds. And so I think a combination of those things. Yeah. So
we have a couple more questions. I hope everybody can bear with us for a few more minutes. Michelle.
Sure. The next question is related to some of the concerns being exposed. How can we pressure UCOP into providing all necessary COVID care, including vaccines, to all UC students and workers for free?
So the vaccines are free, and UCOP, if they get a supply of vaccine, will most certainly deliver it, as I said, under the state guidelines to whoever's turn it is to get vaccinated. It's just a question of supply. They don't have their own independent, vaccine manufacturing plant. So
it'd be nice, though. All right, Michelle, next one.
Sure. So the next question is sort of a follow-up to Ken, the last question that we had. Thank you for mentioning the concern that people will feel they are cured with vaccine and won't continue community behavior like masking. I applaud the HDT program as such. I am talking about expanding to Winters, Woodland, West Sacramento, rather than ramping up frequency in Davis, where the rates are lower. Healthcare tends to be done on a county basis. The idea is, would this identify more cases overall and save more lives?
Yeah, again, I think I've already answered that question. So.
All right. So I wanted to thank all our panelists for coming out here and having a really good discussion, I think, on an important topic that I'm sure you guys are going to be talking about for the next 6 months, or maybe even next 9 months until the fall quarter starts. Hopefully we can get this thing under control, because I can't believe we're coming up on a year of this already. In one sense, it feels like yesterday. In another sense, it feels like 10 years. I don't know how you guys feel about that, but thanks everybody for coming out, and we will have this live or up on video shortly.
Thanks, everybody. Nice seeing everyone.
Thank
Stay safe.
you.
Stay
Take
safe.
care. Take care. Bye.